Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hey everyone, welcome back to another episode of Straight Outta Health IT. This is Christopher Cunny, your host, and we're here to dive into the intersection of healthcare, technology, and everything in between. Today, we'll be tackling a very critical topic that's affecting not only our healthcare professionals, but also the quality of care for millions of patients across the country, clinician burnout. This topic has been at the forefront of healthcare discussions for many years, but the challenges have only intensified, especially during the wake of the pandemic. And who better to help us explore this issue than my guest today, Dr. Maiysha Clairborne. Dr. Clairborne is a physician, integrative medicine practitioner, and a transformational coach specializing in helping physicians and healthcare professionals prevent and recover from burnout. Welcome to Straight Outta Health IT, Dr. Clairborne.
Thank you. Thank you so much, Christopher. And please call me Dr. Maiysha or call me Maiysha. Dr. Clairborne is for inside the exam room.
That sounds good. Dr. Maiysha, because I respect the position as well.
Appreciate that.
Absolutely. Before we jump into the conversation in greater detail, I always ask my guests to share their own personal journey and personal story. How did you get into the practice that you're in today? What led you down this path? And what are you passionate about that you're focused on today? I'm going to turn it over to you and can you share with my tribe, as I like to call them, your story, your journey?
Absolutely. And I'll share up front. And my story has lots of twists and turns. And so
even better.
Yes. I'm a family physician by training. And I'll start with that. I've been out of clinical medicine now for, I can't believe it's been around 7 years.
Oh, wow.
That was when I began my transition. And so.
Was that because you got burnt out?
Well, interestingly enough,
yes.
I experienced burnout early in my career, but it wasn't burnout that actually had me leave medicine.
Okay.
It was the desire to have colleagues not experience what I experienced early on.
Okay.
And to find meaning in medicine. So I love that question. I always get asked that question, did you leave because you burned out? But actually, I didn't.
Oh, okay.
Yeah.
Well, good. I'm sorry. I didn't mean to interrupt you.
Oh, no, of course. No, not at all. And by training, and my path has always been different. From even before I started medical school, I was interested in this alternative, what we called back in the day, alternative medicine. And so it's now called integrative or functional medicine. There's all different types of names of it now. But I knew from a very early time that I thought differently from most doctors. I thought differently from most of my colleagues. And I was very concerned with preventive medicine. And there wasn't a residency around it, so I trained in family medicine. Fast forward, I come out of medical school, going into residency, and by the end of my first year of residency, I was experiencing this thing we now call burnout.
Oh, okay.
Back in the day, we didn't have language. Now, this is back in 2001, 2002.
Sure.
But
absolutely. I figured you were a prodigy. You entered into medical school at 12, which is a whole nother story.
But yeah, so I remember my second year in residency. Family medicine's a 3-year residency. We were doing overnight calls usually about every third night, and sometimes every other night. So imagine being on call, coming off call, then going back on call.
Exactly.
And I remember coming home. I was already experiencing this sort of functional depression, which I didn't recognize what it was at the time. I was suffering, and I came home from call that night. And I thought to myself, I quit, but not like I quit medicine, but I quit life.
Exactly. Oh, wow. Really?
Yeah. And I remember that night so clearly, and I had the motive and the means, as they said.
Sure.
And luckily for me, there was just like enough pause for me to pick up the phone. And I called another friend, and I went to sleep and made it through the night. And then the next day, a classmate of mine escorted me, and the rest is history. I'm here.
Sure.
And it was very clear to me at that time that I wouldn't practice medicine the way everybody did.
Okay.
So
But did you go seek counseling at that point?
I did not. I did not. And I'll share that actually leads me, that plays a lot into why I do what I do now.
Oh, okay.
And so I'll share now why I didn't go to counseling is because I had a colleague who at the time had reported on his application for licensing that he had in the past been treated for depression.
Mm-hmm.
And in fact, what happened was that his license was delayed and he was
Interesting.
taken off of rotations.
Oh, wow.
And for a particular, it was like a probation S. They didn't call it probation, but that's what it looked like.
So it's a stigma. You admitted that you had some mental health challenges, but you sought help for it. But that was still being the negative, huh?
That's right. That's right. And at the time, this was like, he had reported that in the past, he had been treated. He was cleared. It wasn't, there was nothing present going on, but he was still penalized for that. And so it was an unspoken message to me that you got to keep your mouth closed. So who I went to was my classmates, not my attendings.
Exactly. I can imagine a number of clinicians feeling the same way. I'm dealing with these issues. I'm either having to deal with them alone or I can't go to seek professional help. I've just got to endure this. And then that leads down a negative path as well, too. But anyway, I interrupt again.
Yeah, it's all good.
Yeah.
And fast forward now I'm in clinical practice. I've been in my private practice. I'm enjoying what I do. I've carved out my way to practice because, as I said, that was like the next day. And once I got my mind clear, I knew I was not going to be able to practice the way most doctors practice. Like I'm not built for that.
Exactly.
And I had some shame about that for a while. And then I realized that later on, that was actually a gift.
That's right.
Yeah. And I was 5 years into my own private practice, clinical integrative medicine practice. Mm-hmm. And I just got this idea that, you know what? I was teaching medical students about how to create their ideal career. I was doing talks around creating the ideal career, even with colleagues. And I thought to myself, this is probably being in clinical medicine, seeing patients one-on-one is probably not my end point. I'm probably going to do that for the rest of my life. And I started to discover the love for coaching and the love for teaching.
Exactly.
And then I discovered this language called burnout. And I was like, oh, this is a thing.
You're right.
And And so then I started listening inside of these various groups that I was in, colleagues talking about all of these things they were experiencing. And I'm like, oh, I know that. I experienced that way back in residency.
Exactly.
And unfortunately lost a couple of colleagues to suicide. And then I heard the statistic, and this is when it really hit me. 300 to 400 doctors complete suicide every year.
Oh my God, I didn't realize it was that high.
And when I heard that was like back in the day, I don't know what the statistic is now.
Or now, you're right, especially post-COVID.
Exactly. And so I thought to myself, that is a doctor a day. That can't be. And so for me, that was really the impetus for me to say, you know what? I know what my next path is. I know what my next career is. And so I exited and I started to coach doctors around how to create meaning, how to bring back meaning into their careers, how to create careers that they love, how to organize themselves so that they weren't overwhelmed and burned out, how to advocate for themselves in particular ways. And what I found was there was a lot of feedback around the toxicity of the culture of medicine.
Right.
And I knew that, but I knew it because I had been through it, but I didn't know the extent of it. And so...
Well, I want to delve into that. We talk about this concept you mentioned, clinician burnout. It's not a new phenomenon, to your point. We now have been able to define the term and try to understand that a little bit better. But it's definitely escalated a lot over the years as well, too, or at least more awareness of it. But but especially since, as we mentioned earlier, COVID. Can you define exactly what it means to experience burnout, and what are some of those key causes that clinicians are dealing with that get them down, that cause them to now feel like they're in a burnout mode?
Absolutely. Absolutely. So such expanded definitions of burnout, and three of the key characteristics. There's the sense of exhaustion. There is definitely the sense of exhaustion there.
Sure.
And I think that initially there was more of a physical exhaustion, but now we know it's like a mental, emotional, psychological exhaustion.
Exactly.
And then there is this depersonalization. So after you have been exposed to so much trauma, be it the trauma of your training or the trauma of your industries, the people who are seeing in the front lines and they're seeing, imagine in COVID, I can't even imagine. I wasn't on the front lines at that point. But then you begin to depersonalize, which basically means disconnect, like you're disassociate. So there's that sense of depersonalization, feeling out of place, out of your body, like just going through the motions. Then there's
dealing with tragedy every day, especially again, during the pandemic, when you saw scores of people dying and really do anything that's help them at the time.
Exactly. And no matter what specialty you're in, it happens. I remember even in residency, I would go into the room with one patient and maybe had to give them bad news of a diagnosis. Maybe it was from diabetes or hypertension to cancer. Then I had to go into the next room for a mom who was newly pregnant and happy. And it was just like,
yeah, how do I switch gears?
You need to switch, but you have to.
Yeah.
And then you go into the room after that and it's more bad news. Maybe you have to admit somebody to the hospital. Then you go into the room. So it's this roller coaster and you just learn to compartmentalize until you're just not connected to your body anymore.
Absolutely.
Right? Because
after your shift, how do you now become human again?
That's right. And then there's this sort of sense of futility, which is no matter what I do, it's never enough. No matter what I do, it's never enough from the standpoint of no matter what I do, my leaders say I'm not doing enough or my organization says I'm not doing enough. But also there's so much inequity in the system. There's so much, no matter what I do, it's never enough. So it's the sense of you're running on the hamster wheel, but you're never getting anywhere. It's never enough.
Exactly.
And those are some of the key factors. Now, I would add there's the other thing that I think is not as talked about, which is why I do what I do, is this lack of safety. Not feeling safe in the environment, not feeling psychological safety, psychologically safe, not feeling safe in your own body.
I want to explore that in just a second as well, too. But obviously, just the job of taking care of patients and dealing with the day-to-day trauma and the roller coaster ride of the different cases you deal with, some that are tragic and some that are happy, and how do you mentally handle that? But then we also hear some of the administrative burdens that are placed on clinicians as well, like the excessive charting. Unfortunately, electronic health records were touted to be the savior, but in some cases it's created more stress for them, longer hours and lack of control of their environments as well. Are you hearing from your colleagues that this continues to be the case as well?
Absolutely. One of the things that I would hear a lot of is that there's the struggle of seeing so many patients and then having to finish all of those charts and then having to deal with the inbox and not having enough support staff to help with that. But particularly when it comes to the having to manage the charts, one of the things that I've seen happening is people being penalized for not finishing charts, but also not having the support like a scribe or administrative support from your nursing staff and things like that to be able to help to complete that. And also some of it is just lack of awareness or lack of training of how you can most effectively use EMRs. It's
especially those who aren't digital natives, right? Who with computers weren't comfortable with, and now they're forced to try to navigate these technologies and make them a part of the clinical care process. I can imagine that was equally frustrating for maybe some of the older senior clinicians as well.
Yeah. And when there's not enough support to say, hey, let me show you how you can create this template. Let me show you how you can best utilize this template or these templates. Then the doctors are left to become coders.
Is that right? Exactly. Not very good ones in some cases.
We're not that. Yeah. Even though I'm digital analog, I was lucky enough in residency that the residency I chose had Epic. Even back in 2001, going into residency, I started on Epic, and that was just luck.
Exactly. Yeah. Your training was based on using electronic technologies and as a part of the care process. Okay. What now? I want to go back to this, something you said earlier, and that was feeling safe. Let's talk about that a little bit more. What do you mean that clinicians aren't feeling safe?
So there's obviously a lot of physical assault and violence against healthcare workers these days. And what I'm also talking about is feeling psychologically safe. And
Okay.
so there's a few components to psychological safety. There's inclusion safety, so feeling included. And that's really, if there's no inclusion safety, that's where the buck stops.
Mm-hmm.
Right? Nothing else can happen if a person doesn't feel like they belong inside of an organization, whether it's they belong because of their identity or because of their religious choices or because of their gender or because of their skin color. It doesn't matter. If you don't belong, then you can't have any other safety. Right?
Exactly.
But then there's learner safety, and the learner safety fulfills the need to learn and grow. And in our industry, and also so the learner safety includes like safety to be able to make or disclose mistakes.
Okay.
Which is a huge missing in our community. We're taught either overtly or covertly that making a mistake, you can't make mistakes at all. Now, it's understandable.
Right.
Because in medicine, mistakes cost lives. However, if there are early signs, like in training, if there's the communication that there's fallibility, we are human, and we're taught differently about early disclosure of mistakes, then it helps us to be able to ask questions and learn a little bit differently.
Absolutely. And I can personally attest to that as well, too. I recently went through a procedure, and I firmly believe a mistake was made that has had some, quite honestly, some long-term effects for me physically.
Mm-hmm.
And as I pointed those out to the clinician who did the procedure, he was really unwilling to admit that, there was a mistake that happened here, and here's the downstream effect now. And maybe he's concerned that I may pursue something litigiously or report him or whatever. But no, I'm just trying to understand how I now deal with it now that I understand that, or to confirm that this was actually a mistake. Now, how do we manage it and deal with it going forward? And so I can understand, one personally as a patient, I'm concerned about that. And then I'm interested to hear from you. Could you talk a little bit about how clinician burnout does impact quality of care to patients as well?
Yeah, so before I get to that, I want to touch on the last two parts of the psychological safety, and then I'll come back to that because there's a couple of things I'd love to say about that. So there's that learner safety. Then there's contributor safety. So this is where voices are heard. And when there are ideas to make things better, so contributor safety fulfills fulfills the need to make things better. And then there's challenger safety. And challenger is like the safety to report. Safety to challenge the status quo.
Mm-hmm.
And so when you don't have any component of those, psychological safety isn't present. And to your earlier question, it does over time erode trust, and it causes burnout, because what happens is when you are always looking over your shoulder, it becomes harmful.
Exactly.
You become hypervigilant. It increases stress. It increases mental strain.
Exactly.
Then that's when the depersonalization, the dissociation, the disconnection begins to happen. That's when the sense of futility comes in. So that lack of psychological safety in any one of those categories, it just creates this hypervigilance and activates that survival response in people.
Sure.
And over time, that survival response burns people out.
Exactly. No, makes perfect sense. And then if you do make a mistake and you're not willing to admit it, and then the patient goes on thinking one thing versus another, it actually becomes almost a self-fulfilling prophecy. If the patient goes and gets a second opinion, realizes, a mistake was made and you didn't admit to it, now I have a right to go and hold you accountable for that mistake and the fact that you tried to cover it up as well too. So
absolutely.
Yeah.
And just to come back to what you talked about, like as you're trying to point out a mistake and the person's unwilling to admit, that's medical gaslighting.
Exactly.
That's medical gaslighting. And that happens very often, unfortunately. Like, I love my colleagues, and I also know that medical gaslighting is a thing that we need to work on. And I also understand the source of it comes from the training. So like the solution is to dismantle the mindset that we have been conditioned into because it's harming patients.
Exactly. And again, becomes a self-fulfilling prophecy as well, too. If you don't admit to these things and figure out how to correct it and get better at it, then you continue to make those same mistakes. And then
Right.
ultimately, you'll be held accountable for them at some
Right.
point down the line.
And not to mention, if a mistake was made and caught early, could be changed courses to mitigate future harm.
That's right.
Like that, if we're willing to, that's why that safety is important, is if we're willing to admit, okay, this went wrong here, and here are the options to be able to now correct the mistake, or here that can mitigate future harm,
Mm-hmm.
then it's actually helpful in the long run as opposed to harmful.
Exactly. So talk to us then a little bit about how do you then go approach addressing this issue of burnout? We're seeing the great resignation happen, a lot of folks leaving healthcare, a lot of folks are just getting older and retiring as well, too. And we're not replacing them fast enough, given the number of people who are going to need healthcare in the future. Baby boomers or the silver tsunami, as they call it, is going to have a huge impact on healthcare over the next, couple of decades. We're not encouraging young folks to see this as a valid profession going forward. I know I'm asking a lot of questions here, so I'm just curious. One, what are some things you can share with our tribe in terms of those who are clinicians that might be struggling, some advice to help them down this path? One thing, obviously, is to pick up the phone, call you, right?
That's one thing.
That's one thing. But are there some things they can do on their own, at least to start to recognize the next steps or ways to manage this more effectively?
Yeah, absolutely. And I want to say off the bat that there's not one right answer to this
Sure.
question. I think that this is such a systemic problem that there's multiple ways that we're going to have to take in order to begin to solve this
Sure.
issue of burnout. So I'm going to speak from an individual standpoint, and then I want to come back around and speak from an organizational standpoint, because I think both are valid, both are needed. And as I worked initially, I worked more from the individual standpoint.
Right.
And I think as an individual clinician, when you have to first recognize the symptoms, we are trained to ignore our bodies, to ignore our own symptoms so that we could take care of patients. And any clinician listening will recognize this. Just eat when you can, sleep when you can, or sleep is for sleep. I'll sleep when I'm dead. It's like that kind of stuff that's ingrained.
Yeah.
That is why people are.
All right. That's not a healthy.
Yeah, it's not healthy at all. And so we have to be able to recognize what that feels like in our bodies, what it feels like in our own thoughts and minds. And so that's the first thing I'd say, recognize it in yourself. And then I think the second thing is to be able to recognize what's the main contributor? Because oftentimes people will think, well, work is the contributor, but sometimes it's home. Or sometimes it's the combination of work and home.
Exactly.
Maybe work is okay, but it's a lot. But then you go to work and you go home and you have no break. And so which is the biggest contributor? Is it the workplace, or is it the home place, or is it a little bit of both?
Exactly.
Because once you identify the problem, then you can look more specifically at what elements are contributing and begin to create solutions around that, right?
Sure.
If it is in the workplace, how can you advocate for yourself? What do you need? And one of the things I used to find when I would coach doctors is that there were things that they needed that they hadn't asked for because they thought they couldn't get it. And so I would teach them how to ask for what they need specifically.
Right.
What is the language that you use that if you spoke it would speak into the listening of the leadership?
Exactly. So just so that I'm clear as well, and our tribe is cleared. So there have been times where doctors or clinicians have requested certain things and they were either told no, or they knew that the environment was such, if I ask for it, I'm not going to get it. I'm not even going to ask at all.
So there are times where they have not asked. And so when they ask, they're surprisingly told yes. Or maybe it's, I can't do this, but I can do this. And
Sure.
It opens the conversation.
Okay.
And you're right. There are times where they're like, I have asked and I've been rejected every time. That's information.
Exactly.
What are you willing to do? Are you willing to begin to look at other options? Exactly. Exactly. We don't have to just take it. There are other organizations that will fulfill the needs that you have. And if you want, then you need to start looking. So
Right.
those are the conversations we have. Yeah, it's both. It's both and. I think those are some of the big things. And then the other thing that clinicians can do if they have the bandwidth and they're passionate about the physician, clinician being, then they can actually get involved in and step into leadership positions
A good point.
because that's what's needed.
Fix the problem yourself. Get in.
It's become a part of that, become a part of that solution. And I'll say some clinicians are about it. And some people are like, that's not my lane. Whichever you choose is okay. Just know that we as clinicians have to also be at the source of our solutions.
Makes sense.
Because the industry is a Titanic and it takes a long time to turn that around.
Absolutely. Absolutely. No, great advice.
Yeah.
The show is called Straight Outta Health IT. And now on this show, we do talk a lot about technology to some degree, and in particular, things like electronic health record systems, telemedicine, AI. All these innovations are supposed to improve the efficiency of patient outcomes. But at the same time, we talked about earlier how they can create a lot of issues as well, too. I'm curious, what's your take on how technology has had an effect, and I'll just leave it at that, on this issue around clinician burnout?
I think there are positives and negatives, as with all things. I think some of the positives that I've seen is there's beginning to be AI technology around scribing. I believe that electronic medical records are becoming more efficient.
Exactly.
However, yes, at least from what I've seen and what I've heard. However, I think that from an organizational side, the advent of technology has caused them to create a more factory-like environment.
Oh, interesting. Okay. Expound
Right.
on
And
that a
so
little bit.
now we have technology.
All right.
And so you can see more patients.
Oh,
You can see them in shorter amounts of times.
all right.
You can
Exactly. The expectation is to be
you be more efficient. And yes, you have technology of scribe. We're not going to give it to you. Right? We're not going to spend the money on that. So there's a little bit of resistance from that standpoint. I do believe that for native analog practitioners, there needs to be a little bit more support around learning how to use this technology. I think there's not enough support around that. And I think there's so much to learn. I'm learning about virtual reality and how that's used in patient care. I think telemedicine, it was long overdue. And I think one of the highlights, unfortunately, like the pandemic did a lot of things, but one of the good things that it did is that it validated the need for telemedicine.
Exactly.
And I think
there could be efficacy in the delivery of care, even if it's done virtually or remotely.
Absolutely.
Yeah.
Now, on the flip side of that, I think there's sometimes patients are like, I don't want to come in because I can just see you over the telephone. And there's still a need for doctors to touch patients or clinicians to touch patients time to time. And so it does that as well. But I think it allows for reach into place where we might not normally be able to reach patients. So there's and it gives clinicians so many more options to practice, so much more flexibility. You can have a whole career where you are the telemedicine doc and you don't have to go in. You have a counterpart that's in the office that if they need to go see. So it just there's given flexibility to our profession. So there's so many good things. And then there's some flip sides as well.
It's a double-edged sword.
It is a double-edged sword. And we have to recognize that there's always going to be a both and. Two things can be true. And there can be the double-edged sword. It can be good and there can be challenges. And it's not all one thing.
Absolutely. Yeah, like most things in life. Before we wrap things up, and thank you so much for your insights on this. I think it's a conversation that we need to continue to have on an ongoing basis. Clinicians are people too, right? And they need to recognize that themselves, that they need to see the signs when they're not feeling healthy, both physically and mentally. And it's okay to ask for help. And I think the system overall has to respect that and encourage that as well too, so that they can continue to keep these folks as a critical part of the delivery of care as well. I'm just curious, any final thoughts you might have that you'd like to share with the tribe And if someone wanted to reach out to you to engage you for assistance or education or coming to talk to their leadership about establishing these types of services to support them, where would they reach you as well?
Yes, thank you. I do want to just bring one other point, which we all have our personal responsibility, but I can't ignore the responsibility of organizations and leadership. And for leaders who are listening, leaders, organizations who are listening, I think one of the things that I talked earlier about psychological safety being a perpetuator of burnout, we have to look at this conversation of how do we begin to restore trust and safety in our organizations? What are the steps that need to be taken to be able to restore trust and safety? And I know that a lot of times it feels like this is soft skills, but it's not. It's essential. These are essential things and people's organizations. I feel like they should recognize this. I don't know. Maybe they don't, but they spend so much more money to replace their clinicians when they leave.
We're trying to retain them.
When they can just invest in the things that they need to do, the education, the assessment, the consulting, the whatever, the training, to be able to retain them and listen to the voices that are proximal to the experience. And so I think that's just such an important thing to be able to restore trust, is listening to the voices of those proximal to the experience and being invested in what's important to them and making the changes. It'll ultimately benefit the organization. It'll ultimately benefit patient care,
Sure.
Right? If you take care of the people in the middle.
Seems logical to me. Since logical, cost less and have better, happier clinicians, happier patients, better clinical outcomes. And we all want all those things as well, too. And what's the definition of insanity? To keep doing the same thing over and over again, expecting a different result. We're clearly seeing the result of what we're doing today and its impact on our clinicians and their well-being and the overall well-being of the patient. So we have to shift gears and change and think about the whole person as well, too. And physicians are people, too. And clinicians are people, too. So if someone wants to reach you to learn more about your programs and services, how would they do that?
Yes. If you're on LinkedIn, I am always on LinkedIn. So you can look me up. It's just Maiysha Clairborne. If you look me up, nobody spells their name like me.
Yeah, it is pretty unique.
So you can LinkedIn / Dr. Maiysha. I'm Dr. Maiysha on all platforms. If you're on Instagram, if you're on Facebook, if you're on any of the other platforms, but I'm I am on TikTok, but mostly on LinkedIn. If you want to learn a bit more about my offerings, that is, whether you're interested in having me come and speak, whether you're interested in learning a little bit more about the executive coaching, whether you're interested in learning about, I have a course called Communication That Transforms, the trauma-informed communication CME accredited course. It's mindremappingacademy.com, mindremappingacademy.com. And you'll see everything you need to see there. And you can reach out to me either on the LinkedIn platform or you can schedule with me through the website.
Perfect. I think we'll leave it there for now. It's been such a pleasure to have you on to share your thoughts and insights on this very important topic. Again, thank you, Dr. Maiysha Clairborne, physician, integrative medicine practitioner, and transformational coach, who's changing the lives of clinicians and helping them live healthier, more balanced life by addressing the issues and symptoms associated with clinical burnout. Again, listeners, thank you for taking time out your busy schedule and joining us. And if you like what you heard today, please share this with your friends, family, business associates, people you don't even like. Everybody can grow and benefit from good information. And I think Dr. Clairborne provided some really juicy nuggets that we can all take away and leverage as well. So until next time, take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.